I have a long history with Dartmouth now. I came from medical school back in 2000 and stayed through residency as well as through a year getting a master's degree at the Dartmouth Institute. So when I was leaving to do my sports medicine fellowship, I looked at a number of places, but ultimately decided to come back to Dartmouth, partly because of the familiarity and what a great place the Upper Valley is to live and raise a family, but in particular because of the colleagues that I knew that I would have coming back. They had all been my mentors and teachers through medical school and residency, and to come back and have them as colleagues was an opportunity I didn't want to turn down. I completed a one-year fellowship in orthopedic sports medicine at the Stedman Clinic in Vail, Colorado, and that was 1 year dedicated specifically to sports medicine injuries, injury prevention, surgery. I worked with a number of well-known sports medicine surgeons in Vail, specifically Dr. Mark Philippon, who's a pioneer of hip arthroscopy and treatment of labral tears and impingement, and Dr. Richard Stedman, who was a pioneer in knee surgery back in the 60s and 70s, continues to be an active sports medicine surgeon around the knee, ACL tears, meniscal tears. I'll be treating a variety of different conditions in the knee, hip, and shoulder. In the knee, ligament and other soft tissue injuries such as meniscal injuries, cartilage injuries. In the hip, we treat labral tears and bony abnormalities consistent with the concept of femoroacetabular impingement. And around the shoulder, rotator cuff disorders, instability in younger athletes, and in older athletes and active people, arthritis with total joint replacement. The biggest addition that I bring to the sports medicine team here at Dartmouth is the hip arthroscopy component, treatment of labral tears and impingement. That's something that is very new. The concepts around hip arthroscopy are very new. We've only been performing hip arthroscopy as a profession for the last 20 years or so as compared to the knee and the shoulder, which have been in practice for 10 or 15, 20 years, longer than that. So it's a new field, and that we're learning a lot about different pathologies that we can treat, different ways that we can help patients. After college, I got very involved with outdoor sports, adventure sports. I actually taught high school at a boarding school that had an active outdoor sports program and coached kayaking and backcountry and telemark skiing. So I've always been very active, and athletics have been a big part of my life. I continue to be an avid runner, hiker, occasional kayaker. And so when I was looking to choose a subspecialty within orthopedics, it was really an easy choice because the patients that I see in sports medicine remind me a bit of myself and their desire to be active and stay active and get back to those passionate activities that they have. We work in conjunction with our physical therapists. We have a nice relationship with therapy, and to the point where a few days a week we have a therapist actually in our clinic in a room at the end of the hall, and if we have a patient being seen who would benefit from therapy instructions that day, we simply bring them down to the end of the hallway and introduce them to Steve or Dave or whoever's working with us that day and get them right in for an immediate therapy appointment, which can be extremely beneficial for the patient as opposed to having to schedule another time to come back and start working on things. You can get the process rolling right away. So that's been wonderful. We've been working very hard under the leadership of Mike Sparks on an ACL pathway that involves a specific therapy program, and our therapists are seeing our patients the day after surgery, getting them immediately started on our program, and making sure whether they're going to follow up with our therapists here at Dartmouth or someone closer to home, that we're all on the same page and everyone's therapy is appropriately tailored and structured to them. In general, sports medicine patients are a remarkable group who want to get better, who are willing to work hard to get better, and I think that's actually a key to orthopedic sports medicine, is that relationship between the physician and the patient, understanding that the patient gets better not through something that I do or something that a a therapist does or something that another surgeon does, but they get better through a kind of combination of work that a surgeon does and work that the patient does. So a surgery performed well will fail if a patient doesn't follow through with the appropriate physical therapy. We see an amazing variety of patients in the sports medicine clinic. We certainly are not seeing exclusively competitive athletes. We're seeing patients from the upper valley who have had injuries, twisting mechanism injuries, falls. In general, patients are trying to regain a lifestyle that they've had prior to an injury. And in general, our goals are getting them back to an active lifestyle. But we see people who have desk jobs, who do a little bit of hiking on the weekend. We see people who are practicing with high school teams for 3-4 hours a day through 3 seasons. So we see an incredible spectrum of patients and activity levels. Dartmouth really has a significant history with regards to U.S. skiing, and one of the really pioneers in ski racing in the United States was Dick Durrance, who was a Dartmouth undergraduate, and in the early part of the century was involved with ski racing at Tuckerman's Ravine and ultimately ski racing out at Sun Valley, Idaho. And I think that tradition continues. We have a number of physicians who've been associated with Olympic Games. Ed Mehrens has been involved with the biathlon team. Chris Carlson has been involved with the crew teams over the years, and I'm excited about my involvement with the U.S. women's ski team and the speed program, and looking forward to that association.